Let's talk about addiction, lessons in recovery with James Dittman and Dr. Alfonso Brown is a podcast offered by New Beginning Health PC. At New Beginning Health PC, we provide treatment for individuals in recovery from opioid and other forms of drug addiction. If you need treatment for addiction today, please feel free to contact us at newbeginninghealthpc.com. That's newbeginninghealthpc.com. Imagine a young woman walks into a busy clinic. She's 27 weeks pregnant, and her hands shake as she whispers a confession to her OB-GYN. I've used heroin in the past, and I want your help with my pregnancy. In that moment, a doctor faces a question far greater than a diagnosis. It's a legal, ethical, and emotional fork in the road. Should physicians be required to report patients who are pregnant and have a history of drug addiction or use? Welcome to another episode of New Beginnings in Recovery with James Dittman and Dr. Alfonso Brown, brought to you by New Beginning Health PC, where addiction medicine treatment meets meaning. Today's conversation will take us into the heart of one of the most controversial and emotionally charged dilemmas in healthcare. Our special guest, Mr. James Dittman, is a man who has dedicated his life to his own recovery and ensuring the recovery of others. Join us today as we unpack the tangled web of duty, trust, stigma, and care. This is a conversation you didn't know you needed, one that could change how you see your doctor and yourself. And great. I want to welcome everybody to today's new episode of Let's Talk About Addiction, New Beginnings in Recovery with James Dittman, Dr. Alfonso Brown. We have a special guest today also, Mr. Joseph Lauper, who's a patient at New Beginnings Health PC. How you doing, Mr. Lauper?
I'm good, thanks.
Okay, good. And Mr. Dittman, how are you?
I'm doing very good. I feel good today. Thank you.
All right. For those of you who are new to our broadcast, or for those who've been listening, we attempt to have some serious discussions about issues that follow the entire spectrum of recovery. Mr. Dittman is an advocate for recovery for individuals who are in recovery, as is Mr. Lauper, and they're very deep thinkers and very focused. And today, I'm going to go into try to answer a very central question. And it centers around the fact that should clinicians be required to report patients who are using drugs during pregnancy? And this is a very challenging situation. Both of the guests today are male, so they haven't been pregnant, but they are probably aware of the problems that can go along when someone has a history of drug use and they're trying to do something like go through and navigate the issues of a pregnancy. So we're gonna just jump right in, and we will defer to the guests to provide feedback as we go through it. Thank you guys again for coming today. So in today's discussion, we're going to talk about, and all cases that we present are based on hypothetical individuals. While names have been changed to protect people's privacy, and so any resemblance to a known person is purely coincidental, as these cases are constructed to teach and are not based on an actual individual. Today's patient is named Danica Kennedy, and she is a 26-year-old woman who comes in to see her OB-GYN, and she's 27 weeks pregnant at the time. And she's been attending prenatal appointments up until that time, but today is a special day because she's going to disclose something that she has not told her doctor up until this time. So during a routine prenatal visit, she confesses to her OB-GYN that in the past she had occasionally used heroin just to get through the day. She states that she wanted to let her know about this at this time because she really wants her help and wants to make sure that this pregnancy goes through the term and everything works well. And I can give you a little bit more background on that. Um, Mrs. Kennedy is a single, well, this would be her first child, lives on her own in a high crime area where there's a lot of active drug use outside in the neighborhood and even in the building that she lives in. She has a job. However, she'd been recently looking for a roommate in anticipation of the baby because she would like someone to share the expenses so that she feels she can provide a little bit better for the child. And this is her main issues. All right. So, any thoughts or concerns as we present the initial part of the case?
Well, I think her coming to the doctor, um, out of concern and just being honest about the whole situation is a very good thing. It starts everything off on a good note, and it shows, um, you know, how serious and how much she cares about the whole thing. So I
Yeah.
think that's a good thing, and the fact that
Um,
she's looking for support, um, at home.
okay. All right. Mr. Lauper, any thoughts?
No, sorry, I was just blanking. Is she using or is what I'm just
Well,
like
why do you
my
ask that?
brain hurt.
Why do you ask that?
I don't know if I missed
Well,
it.
let me ask you a question. Yeah. She's 27 weeks into the pregnancy, and she's had several visits with her with her obstetrician gynecologist. But this is the first time she told her about the heroin use history. Um, so are you concerned, Mr. Lauper?
Oh, I just wanted to clarify. I just I blanked there for a second. I just wanted to double check that that's what I thought.
Okay. So, okay. Okay. Are you concerned that this is the first time she's mentioning this to her primary care doctor after we're 27 weeks into the pregnancy at this point?
Oh wow.
I mean, just hearing about the heroin use raises a little bit of an alarm. It makes you wonder if she's still using, or if she if it was like a confession that she used before she was pregnant.
Okay. So you're concerned about the usage.
Yeah.
Are you also concerned about the usage, Mr. Roberts? Mr. Dittman's concerned about the usage. Are you concerned?
Yeah. Yeah, I'd say just generally, if she had been using it or if she's only done it, a few times, either way, it's still a concern.
Okay. Um, Mr. Lauper, I'm going to ask you to check your. I'm a little concerned that, um, well, we don't want to happen. It's okay if you time out today because I'm concerned that we're not getting all your audio. There seems to be delays, and we don't want to sort of not have your input. So check your audio to make sure it's working. If you're not getting good feedback, though, we might have to ask you to join another time. Okay, when the stream's a little better because there's about a 3-second delay in between when I ask you the questions and we get a response. So I'm not sure if your Wi-Fi signal is good there. We understand. Yeah, it's because if it's not good, we'll have to redo the whole episode. That's the thing. So I just want to make sure it's okay. We can bring you back another time. Okay.
Yeah, I think it's just
Um.
because I'm out in the parking lot.
Okay. Well, like we like to do here. This is all unscripted. We're just talking to you guys. The main thing is we've had a couple of times in the past where when the audio feed's not good, we can't use the material because it sort of goes in and out. So it really, again, if it's not working today, we understand. We thank you for coming on. We just don't want to have to try to correct it afterwards. That's the main thing. All right.
All right, yeah, that's fine.
Yeah. Yeah, we still sort of can't hear you. Um, so what I think maybe you should do, Mr. Walker, is you can sign off for now, and we'll just continue, and then the next week we'll do it sort of when you have better audio feed. Okay.
Okay, yeah, sounds good.
Uh, okay. All right. Thank you, sir.
All right, see you
Thank you.
later.
Yeah. So and we don't like to not have anybody coming in, but we need to make sure the feed comes in strong so that
Yeah.
we get good quality audio. So as I was, let's get back to the case again. Mr. Whopper was asking questions about whether or not the uh, the woman had Danica, our patient, had she disclosed, about usage. And the question I have for you, Mr. Dittman, um, and we'll answer the question about the usage if she's currently using. I wanted to know why you think that's an important question to ask, and if you do think it's an appropriate question, why do you think it took her so long to disclose that to her obstetrician gynecologist? This is not their first meeting; they
Yeah.
met before.
Yeah. Because I mean, obviously, it would raise a concern whether or not she's currently using, or if it was just a confession of being pregnant before. I'm sorry, a confession about doing drugs before she was pregnant or not. Um, but I think I would need to know that for 100% to be able to trust the situation.
Okay. All right. So yeah, it's appropriate, and her obstetrician gynecologist asked the same question, and one of the issues, I guess, central would be is the baby going to be at risk if she's actively using? That would be the biggest thing, given that the
Absolutely.
baby can't advocate for themselves. In this case, the physician would become one of the primary advocates for the baby, and you would expect the patient as well, right? Would not use
Exactly.
for protect the baby.
Yeah.
So she says that she has not been using. She says that she has not used during the time of the pregnancy, but she was using up until approximately 2 months before she started trying to get pregnant. And because she knew she was trying to get pregnant with her then boyfriend, she stopped using. Um, the so the question then becomes, what do you want to do with that information? She told you she's not using, but this is the first time she's telling you about the
Mhm.
fact that she has this prior history.
Yeah, and as her doctor, I think it would be appropriate to request some sort of testing or proof of current usage or not, you know, and
Okay.
um, and just get to the bottom of it. So it's
Okay.
so she knows what she's working with and she knows what to do for her patient.
Okay. Are you interested in why it took her so long to tell you about this? Do you feel a sense of betrayal if you were a physician that she
Um,
wasn't upfront about the beginning?
that's a very good question because she did see this doctor before being pregnant, you know, and
And during the pregnancy, this is about their 3rd or 4th meeting during
yeah,
the pregnancy.
no,
It's
that's a
pretty
good
far
question.
along now.
Yeah, that I guess I would be a little concerned about that. Um,
Yeah.
I never
So
really even thought of that.
would that be information you'd wanna know as well?
Absolutely.
As well?
Just as her doctor, even aside from the pregnancy, I would definitely wanna know that.
Okay. Well, actually, what she says and what happens is, and I think your points are excellent. This is something that should be known, mainly because, as we mentioned, the baby can't advocate for themselves. So we need to make sure that the infant's going to be protected. And as a physician, there are mandated reporting requirements, state laws, when you think an infant or an individual who's pregnant with an infant is at risk. She tells you that she's not using it all. And the reason why she's telling you now is because she was concerned about the stigma. That's why she didn't say anything before that is placed on individuals who use drugs. Um, she says that people look down on you, they make assumptions about you, even your ability to be a good mother. And she wants to really try very hard to do well with this. However, she didn't want this to become an issue. And that's why she didn't bring it up. But because she actually trusts the doctor and she is very thankful for the care she's received, she felt that she should come clean with everything. And that's why she decided to do it at this point. She says to demonstrate her commitment to what she believes in, she will agree to the drug test. Normally, she would question why that was necessary. She sort of, and she's honest. She says, in a way, she feels like the doctor still probably doesn't believe her because she told her that she's not using. But if it'll make it easier and for the care to continue, she will definitely provide information about the drug test. She'll take a drug test and she'll even admit to a hair test if she wants, just to demonstrate the length of time, if that's possible.
Well,
Uh,
it well, now that I think about it, and with that information that you just gave, it's like, and a hair follicle test, that's pretty, legit. That goes back quite some time, and it can tell you, a lot. Um, and it makes me think of the question you asked before, you know, would you feel a certain kind of way that she didn't admit about using before the pregnancy? The fact that she admitted it now that she's pregnant, even if she's talking about using before being pregnant, it shows her good faith as a mother. Um, and it shows how serious she is about the whole pregnancy. I just think that's a good sign as far as parenting.
okay, excellent, excellent. And so you would feel comfortable with that. And as you know, one little thing she throws in, and she asks the doctor. She says she's willing to do this, but she wants the doctor to commit to one thing that she does not contact Child Protective Services against her.
Yeah, yeah,
Do
that
you think that's fair? Do you
yeah. I
think the
think that's
doctor could
pretty
do that?
fair. I mean, as long as the testing comes back good and she's doing everything she needs to do for the child, that I think that's a fair deal. Because obviously, if the doctor sees any wrongdoing or anything unhealthy for the baby, she's gonna have to do what she has to do.
Okay. And so, do you think that the doctor at this point is not living up to her duty to report this, or you think based on what she sees, it's okay?
Well, I just don't know enough yet to be able to
Okay.
make that decision. Same with the doctor. Like, I just don't think she knows enough yet to just jump the gun and call the big guys in to take over.
Are you concerned about the environment and the stability
Yeah,
of the patient?
a little bit. I'd be a little bit concerned about the living environment she's in and the lack of support that she has there, and knowing that there's a high crime area. Little bit.
What else would you want to know for you to feel comfortable?
Um, I would just want to know if she has drugs in her system.
Okay.
Um, and
Okay.
yeah, and what kind of environment inside of her home is going to be like for the child.
Okay. Okay. Excellent. Excellent. All right. I think you've asked some very good questions there, and we'll see how the case progresses. But I think we've got some answers as to why it took her so long and her concerns. Let me ask you: do you think her concerns about stigma about prior drug use and how it might impact her treatment are legitimate? Is that something she should have been concerned about, or
Yeah, as her doctor, I think she has the right to be concerned about her prior drug use. Uh, just in fear of, relapse or any kind of temptation to draw
Yeah,
back to.
right, right. Well, what about the way she would be treated as a patient? Do you think that the doctor or staff knowing about her drug use would impact her care? That's one of the things also that
Oh, I get
she
what
was
you're
considering.
saying. If
Yeah,
she's getting the proper treatment for it, I
yeah,
don't think that's a concern as a parent.
okay. So if you were in that situation, you would have told the doctor up front, or would you have been concerned that, well, you know, if the less they know, the better. As long as I'm not using drugs, then they don't really need to know about the past.
Well, honestly, that's a good question too. And to answer it honestly, of course I'd be nervous to bring it to their attention, uh, but to do the right thing for my child, I absolutely would have been 100% clear about the whole thing.
All right. All right. Well, I think we're all on the same page now. She's disclosed it, right? And she also told her about the environment. Um, she has also asked the doctor about not reporting her to Child Protective Services, but uh, the physician agrees with you as long as the testing doesn't show. And she says, "I can't make that decision until we see what the testing shows." And as
Yeah,
long as the testing doesn't show use, especially the more advanced testing, then we will see how she done. She's given no other red flags, except that the doctor now realizes that in all of the appointments that she saw her, she was always wearing long sleeves and never could evaluate her arms. It just was something that never came up.
of
All
course.
right. Well,
Mhm.
one thing the doctor did not ask about is who was the father. And what
Yeah.
happens is when she goes back home, she's still looking. And there was a guy who shows up but doesn't go into the apartment, and he's complaining, he's shouting at her, and then he leaves. Um, that guy actually happens to be the father of the child, and he is not they're not intimately involved anymore. He's a an ex-boyfriend with a very complicated past. He doesn't use drugs, but the type of people that he hangs out with were the ones who sorta got her introduced to, the drug culture, and, he, uh, seems to be very focused. I'll tell you a little bit about his personality. So what exactly happened is they had this argument in front of her apartment. He left angry, and, he threatened her, and he said, "I'm gonna call" by threatening her, he says, I think you're putting our child at risk with everything that you're doing here." Doesn't clarify on that. What does happen though is he contacts the hospital and says that he's next of kin to the patient, and he says he wants to speak to her doctor. Um, they could not put him through the doctor, but he talks to a clinical nurse that's assigned to her case as well, and he explains that he'd like to file an anonymous report regarding this. He wants to be anonymous, but he says that he understands that she's pregnant and that she's going to have a baby, but she's very concerned that she's using drugs and bringing the baby into an environment where drug use is going to be apparent, and just wants to make that known to her doctor and all the people involved in her care. And then he says he wants to remain anonymous. um, they said that that's an inflammatory tip and he has to give more information. So finally, he reveals who he is, his name. He leaves that there, and then he hangs up.
So he says that he thinks she's actively using and pretty much, tries to, make her look bad
Yeah,
to the doctor.
he yeah, he sort of told him, "Hey, you know where she lives? She lives in a part of town that's always on the news because there's always drug-related stuff going on there. She lives in a building where people are using drugs. She has this history of drug use, and I know that she's using. I just know it, and uh, you guys need to know this, otherwise you're gonna put her at risk." part of the reason why he wanted to be anonymous is because there was an anonymous tip for crimes in their neighborhood, so he would get some extra money if he remained anonymous. But because of the severity of this issue, they said that he needs to reveal who he is. So he eventually did that, and they said that they had to investigate the veracity of what he was saying, and if so, then But it was an inflammatory thing that he said, and just to make sure he was who he said he was, and he would know something. They question about his relationship and those sorts of things.
Yeah.
So
Yeah, I kinda
what
have some questions about this guy too, you know? It's like, if it was his company that kinda got her into drug use, and pretty much he's the reason why she even got mixed up with it in the first place, it makes me wonder, who is this guy he doesn't use? And,
he did
you
not.
know, after he gets her on drugs, why is he, trying to get her in, bad, a bad situation with their doctor, especially if it's his kid? What's his motive? Is he trying to get the kid for himself, or all kinds of questions like that?
So those are excellent questions, and I can tell you about him. He has a prior history of use. Just that was why he had the associations, but he stopped. And when he stopped, he became this very intense anti-drug advocate. So no drugs, nothing. Um,
He's one of them.
However, some of the things that are a little confusing is he still has a lot of friends who are into that life. And when asked about this, he'll often say, "Well, you know what? How am I going to help them if I'm not around them?" So this is something to maintain. Um, of course, his reports to the doctor were very concerning, and it results in a phone call from the doctor to the patient. But what do you think the doctor should do in this situation? You get this tip from this guy who claims that he's her boyfriend. The doctor's never heard about the boyfriend before. She didn't really. She asked about the father, but in the past, patient had said they're no longer together, and she didn't really want to go into detail. But now he's making an alarming accusation about active drug use and threats to the baby.
So she never even told the doctor about him and kinda wanted to keep him out of the picture, and he just kind of introduced himself with that
Well,
confession?
she said that yeah, she said that she'd had a relationship, that's how
Yeah,
she got pregnant, but that they were no longer talking, that he was not involved in her life at
yeah,
all.
yeah, even with that, background history about him, the doctor would have to investigate that, and, if I got that information abruptly as her doctor, I would feel like I had to clarify whether it was true or not, you know?
Okay.
And, it just yeah, I mean, he brought that trouble to the situation, and the doctor has no choice, I'm sure, but to look into it.
So what aspects of it would you be concerned about? His argument that she's using drugs?
Yeah,
Mm,
I would have to, as her doctor, I would want to see if it's true, make sure if she's doing drugs or if she's not. I would be concerned about the living area, like he was talking about, and if the child's gonna be in danger there, especially if she's alone and raising the child on her own. Um,
Well, let me ask you this question. Do you feel you've addressed the issue about drug use?
yeah, I mean, she already proved that she, wasn't, right?
Well, we haven't gotten the results back yet,
Okay.
but
So,
you
yeah,
have
no,
started an investigation into that. And
yeah,
and she agreed in this sense to a more detailed investigation because she wanted to prove at least that it's unlikely that she'd been using during the time that she had the baby, right?
yeah, that's
Nothing's
right.
100%, but
Oh,
she
so she
voluntarily agreed to that.
I'm sorry to, interrupt, so that's right, she
Yeah,
agreed to do the hair follicle test.
yeah.
We just didn't get the results
And the
yet.
other. That's right.
Okay.
But at the time of this phone call, the doctor, says she waited. She waited about 2 days after she got the information to call, and the reason why is because she wanted the results of the testing back, and it came back,
Yeah.
and she now has those results, which, disclosed to
Okay.
you. But, um, she calls her to tell her that the results of her testing shows, in accordance with what she said, she had not been using during that time period for several months. And, also the most recent one, the recent lab, the urine, shows there was nothing in her system at all consistent with drug use, not even marijuana. She doesn't smoke marijuana, she doesn't use any drugs. She said so she's been clean, and it appears she's been clean the entire time, which is what she said. She once
Yeah.
again reiterates to her doctor that she's trying to make, um, a, a change, and she has. But again, she feels a little bad. She says to the doctor, "Would you have been as concerned or likely to believe this had I, not told you that I was a prior user? There'd be no other way you would have
Yeah.
known, really. And now you have this guy who's making random, allegations about me." Um, and, you know, she
Really
then
sparking
tells the
concern.
story of how yeah. So remember again, the concern that she had was that she would be viewed differently when she disclosed this information. Would you say the
Yeah,
doctor is
exactly.
doing that, or are they not? I mean, maybe they're
It
uh,
it's kind of a touchy situation because, like you said, if she never even told her doctor in the first place, she would have never even known, and she wouldn't have even known how to to look at her in that lens. But now that she does know
right.
the history, she has no choice but to, um, treat the whole situation with delicacy on that matter, you know? And she kinda has to see her as a recovering addict along with being, a mother. It stinks, but, once people know that you have a history of drugs, it's like, it's always hanging over you. It's always some sort of, there's always, you know, a consequence for it in the future.
Let me ask you this question: had she not disclosed this, and the boyfriend never called in, would the doctor have known at this point?
No, she wouldn't. She wouldn't have had any clue, which shows, I think, good faith on her end for bringing it to her attention at all.
Yeah,
Shows how serious she is.
yeah. And I asked you that question because I'm going to ask you the next one. And the next question is: should her environment, the environment she's going to bring this baby into, um, create a problem? Remember, she asked not that Child Protective Services not be called in, but she's living in a high crime area,
Yeah.
and
I think
with
the
that,
I
yep,
think the area is a little concerning, but I would have to know more about her home, environment because I mean, you can't really help, what, the, area that you live in does. You can't help, what your neighborhood does. I mean, in that case, I think all that matters is what happens in her home, you know? That's
that's
all she
right.
can really control.
Excellent. And so that's the point. And she says to the doctor that yeah, there's no drug use, as you can see. I'm not using drugs. There's no one that lives here who uses drugs. I go out and I do my job. She says, you can contact my employer. You'll see that I've never missed a day at work. They actually cited me as Employee of the Month several times. I am very focused and I just want to put this behind me. Unfortunately, the place where I live is all I can afford right now. That's why I'm trying to get somebody else to help me out, maybe eventually move out of this area. But for now, this is all I can afford. I live on my own and no one else is here to support me.
That's a little bit of a concern for me too, is that she's alone and she really has no support, at the moment, or
Well,
as far as I
why is
know.
that a concern for you? I guess.
Well, because what's gonna happen when she has to go to work, and, who's gonna be with the baby? How and how
That's an
safe
excellent point.
how safe is a woman and a baby by themselves in a high crime area, and just stuff like that, you know?
Yeah. No, that's an excellent point, Mr. Dimon, and, that's something she's gonna definitely have to address. You have young kids, right, Mr. So,
Exactly.
yeah, he's making and I have 4 myself, so I know exactly it's an excellent, excellent point. So that's something she will have to address,
Yeah.
and, she voices that to her physician that that's something she's actively working on. That's why it's been the only source of stress. She explains also that, although the boyfriend claims he's trying to, um, help her, she explains that he had approached her in a very aggressive fashion. She also says that the way in which this started, was that he wanted to, have her abort the child. When she found out she was pregnant, he wanted her to abort the child, and when she refused to abort the child, that's when he became very aggressive. And, he said that, if she wouldn't abort the child, he would make things very difficult for her. And
Wow.
since he knew she was still using drugs, he would work to get the child taken away from her. So there seems to be some animosity that is being brought into this situation, by this individual, who, as we note, has not also really offered to help her financially or in any of the situations. Again, he says that he made the call because of concern, but he doesn't appear to at least be offering financial support and things like that for his,
Yeah. This
yeah,
guy, I just don't like the sound of this guy, you know? It's like he's not being supportive in the right ways. He wanted to abort the child when he first heard about it, and when he heard that she wouldn't get rid of it, his threat is to make her life hard. And
right,
it's to me, it doesn't even sound like he's just trying to take control of the child or take the child. He just wants to make her life hard, you know,
yeah,
out of you know, his anger that she is carrying his child still when he didn't want it.
right.
I just don't like the sound of the guy at all.
Well, I would agree with you on that, and I think the doctor felt the same way, and also did not because of HIPAA laws, she can't go into details about her discussions with our patient, Miss Danica, but she did, inform her that the issues of, that he's bringing up, they would be taken into consideration, and they would do the appropriate investigation in their own
Yeah,
time.
because like, as a father myself, no matter the situation, when you find out that you're having a kid, you step up as a man and,
Yeah,
you try to protect the kid. You try to protect the mother, you try to be there, support them, even be at the doctor's appointments, all that. And,
right.
just the fact that he's been nothing but, trouble or a threat in the whole situation. Me personally, I don't like that. It's
Yeah.
just cowardly.
Excellent, and, um, these are all excellent points, Mr. Goodman, and I agree, and it shows the type of person you are, again, your commitment to your child in terms of what, you would do, and I would hope that most people that would be their approach. Even though her situation, again, is one that's challenging because, remember, she's working, to try to get around the stigma that's been
Exactly.
attached to, so we're gonna wrap this up in the next, few months with the last parts of the case as we present these, remember she'd been looking for a roommate, and, about a week or so after she had met with her doctor at the appointment, she gets an unexpected visitor, and the visitor is, her sister. Now, her sister is her only next of kin. Both of their parents are now alive. There's no one else. And when her sister is actually pregnant. And uh, and curiously enough, her sister is about as far along as she is in the pregnancy. The sister, though, she has reason to suspect is still using drugs. Not because she notices her behavior, because the sister tells her. And the reason why she had never mentioned the sister before, and the reason why we were out together, is because the sister had been using drugs. and that's why they split up. So now the sister's at a point where her drug use escalated, and she's lost the apartment she was living in because of the people who are coming there to associate with the drug use, and she's potentially going to be in trouble if it's found out. She did very well at hiding her pregnancy, so she's looking for a place to stay, or she's facing having to go into a shelter or something. Um, and she wants to stay with her sister. She offers maybe not money, but she does offer the ability to take care of her sister's baby and her baby when they come along. So that would offset. Um,
Yeah.
so what do you think?
So, I mean, the idea of extra support at home is, you know, it's nice and everything, but with her using drugs and now the doctor knowing it, it raises like, concern that it would be in the home if her sister was around. Um, and it just raises a little bit of alarms now that her sister is, trying to live there. And, knowing that it's her sister and, that you could, you have a hard time just not helping your family and all that. I just think it opens up like a whole new, uh, I don't know, concern
Yeah.
for the
Okay.
child.
Would you allow the sister to live there,
If
even for a
if
short period
she's
of time?
actively using, absolutely not. No,
Okay.
uh, because
It's it's
it would be a threat on the child.
it solves though one of your concerns, right? That she would have somebody to take care of the children.
Yeah, but if she's using, it would be for nothing, because
Yeah.
it would just bring trouble.
Okay.
And
So she had the decision to make, I guess, right?
yeah,
Um, about what she's gonna do. And one little tidbit is that her former boyfriend, the one that he also knows the sister. He knows that the sister has been using drugs, and part of the reason why the sister is pregnant is because the former boyfriend had used to date the sister, but he only did that. He was using her so that he could end up with this Danica. So part of the reason why the sister's pregnant, she says, is because she was upset at the fact that the way the boyfriend treated her. So out of a rebound or revenge, whatever you want to call it, she got herself pregnant with a man that she had no interest in. So she also has no one to help support her. There seems to be a myriad of these types of problems. Um, but because of her connection to the boyfriend, he knows a bit about her and knows potentially that even though he really doesn't care anymore for her, that she does have this history of, or he might suspect it's not 100%. But really, the only one who knows that she's using drugs, is her sister because she's just told her. No
yeah,
one else really knows, but they do have a connection through this old boyfriend.
and it's 100% fact that her sister is using.
Yes,
Yeah,
yes, she doesn't deny that.
yeah,
She says she's trying, and she says she'll do her best to stop, but she wanted to just let her know she wants to start a new life, and she's gonna try her best to stop.
yeah. I think if she did, you know, seek help and really stop, that it would be like a wonderful situation for her sister, like good support, like you were saying. Kind of band together and uh, look out for each other and help each other out with the babies and their sobriety. That would be a good setup for her. But knowing that she is using, there's just nothing she could do with that at the moment,
Okay,
which is a
okay.
shame.
So, as we wind up here, Mr. Dittman, should she tell her doctor about this decision she has to make,
I think so. I think so
and why? Why?
because it would be good to get her doctor's, professional opinion about it, especially seeing how it really wasn't that long ago that she stopped using the drugs. So I think it would be quite a temptation to have it around, and just for the safety of her sister's child, never mind her own.
Should she report the fact that her sister's using drugs to somebody?
So that's a tough question, because obviously you wanna protect your family, but she's carrying a child. Um, I think in her case, she should tell her doctor,
Yeah.
um, but that is a very, very tricky question.
Yeah. Excellent points. So she's not really sure what to do here. She agrees with what you said about the fact that she doesn't think she can bring her sister in because if her sister's using drugs, the temptation's going to be too great, and she might end up using, and she does not want to expose her baby to that. But it is her sister. She feels sorry for her. She's been there in terms of trying to change. Um, uh, and so she says she's going to think about it for a few days, but her sister can't stay there while she's making the decision. And she decides, however, not to tell her doctor necessarily, because she decides after a few days of thinking about it that it just cannot work. And she tells her sister she can't live there. She would have to absolutely have to be clean and show evidence of that and that it's sustained. And unfortunately, although it hurts her, she turns her sister away and says that she can't live there with her. As you can tell, that's a very emotional experience for her. She starts to cry, and several weeks later, she's still in grief. But she ends up going into contractions near her term date, and she goes to the hospital to deliver. At the time she goes there, her obstetrician gynecologist, who she never told about her sister, she made that decision, and she felt it was not necessary to disclose that because her sister never lived with her. She
Yeah.
she told her she couldn't come in, and she maintained. And she goes to the hospital to deliver and delivers the baby. But the baby's a little small, only 6 pounds, and is a little lethargic and comes out. Doesn't do well on the immediate. And so the hospital staff becomes concerned that the baby's a little smaller, not really responsive, but nothing glaring. And one of the associate staff looks through her history and sees this prior history of drug use, which the doctor had documented. Unfortunately, the results of the testing were there, but they don't look deep enough to see that because one of them is an outside test. And so they approach her about this and they said, "Your baby's a little lethargic and underweight. We're concerned." Um, and one of the things that really is that she's in a hospital gurney, so they see track marks on her arm. Um, and they said, "We're very concerned about the fact that you're using drugs and it probably impaired your baby."
Yeah. Well,
And unfortunately, her obstetrician gynecologist is not on call. She's actually on vacation.
okay. So they can't really, um, get her feedback and results at the moment.
Yeah. They have
So,
documentation, so a lot of it is in her chart. They have the
yeah,
information in her chart, but they just can't get.
a hold of her.
Yeah.
Yeah, well, honestly, like, the baby being underweight is not that abnormal. Both my kids were underweight when they were born.
Yep.
And,
Yep.
but for the hospital
And
without it.
and were 2 of my kids as well. So
Yeah,
you're exactly right. Yeah.
yeah, and but the hospital for them to not be able to talk to her doctor, and they just see old results that are a little too far
Well,
back to.
well, the results they see show no use. You're right. It
Yeah,
was from a few
yeah,
months ago.
but you
There was
said,
no
yeah,
need
that
for
was from a few
additional.
months ago.
She wasn't using it. Yep.
So it just raises the question, is she using now? Do they have to prove it? because of the baby being small and seeing the track marks, but the track marks is another question, is like, are they fresh or are they old? Are they, um, I don't know, because that could bring a
And she'd
problem
been
for her
very
at the hospital
sad that
too. They
even
could
when she came in, she
sit
was
there and
grieving
think that she's using
because they're hoping
actively.
that maybe her sister could she was there by herself, but I can tell you the track marks are old.
Yeah.
But again, and in your thoughtfulness, you would investigate that, and
Well,
their lack of
I think
thoughtfulness, they
yeah,
didn't investigate that.
I think the hospital
They just
would.
saw track
Yeah,
marks. Yeah.
yeah,
So we end there, actually, it's sort of a cliffhanger at the end, because we're not sure what happens next, but I purposely designed it this way so that we can ask some of the questions, fundamentally in the beginning, right, her concern about disclosing her history was that she would be treated differently because of her prior use.
yeah.
It seems like through the story, both with her doctor, with this ex-boyfriend,
The
with her
hospital.
sister, and now the hospital, she's had to make decisions based on what might not be an issue anymore, right?
Yeah. In every situation, just because of knowing her history, has looked at her through the lens of an addict, and is she good for her child? But, I think through the whole thing, she did the right thing. She didn't even have to, but she did,
Right.
and, I just think it's a very inspiring and motivating, you know, situation as a mother for her child, and, I think it's just, like, a very good thing that, through all of the troubles and, the boyfriend causing trouble and her sister possibly coming around and having to turn her away, and just how she fought tooth and nail for her child, and to be there for her child in the best way is just like, it triumphs over all of the, concern and alarms, and if you ask me, it's just like, that is like the most important thing of the whole story.
Yeah. Excellent. Excellent. And I would agree with you. I think this is a tough situation. Do you think it's a realistic one? Is this
Absolutely.
something that people go through?
Oh my god, every day, you see
Yeah.
something happen like this. I know so many people in the same kind of situation pretty much, maybe a little different in, different aspects, but, this is a very common thing,
Yep. Yeah.
and it's
And it's
hard.
unfortunate, don't you think? Yeah.
Yeah, it's very
We
hard
we're
for
all
people to.
taught that we need to forgive, but a lot of times it's hard for people to forgive,
Yeah.
and we're placed in this lens. Um, any other thoughts or concerns, Mr. Dittman?
Yeah,
Anything you think she could have done differently?
yeah, it is a shame, people that don't understand the whole addiction thing, how they see you, they look at you like you're less than or to be untrusted or incapable of even having a normal life or doing normal things, and, it can be very, it could really put the person down, and it
Right.
could really even put them in a bad mindset, like, it's pointless.
Yeah.
All this work's for nothing. People are still gonna see me this way. Um,
Yeah.
should I even bother? You know, should I just accept it and, screw the whole thing? But, no, obviously I say, no, it doesn't matter what anyone thinks. As long as you're doing what's right and, you're doing the best you can, you know, who cares? Who cares
Yeah.
what anybody thinks?
Excellent. I agree. And I think you've highlighted one of the major take homes here. Who's going to benefit from the right that she's doing when nobody? It seems like the things that she's doing behind the scenes, staying clean, going to work, it
Yeah,
might be hard for her to prove those things, but ultimately, who's going to benefit from those?
exactly, exactly. It's like, because, like, at the end of the day, just like you're saying, you're gonna go home and it's just gonna be you and that child. And
That's right.
that's your real world. That's your real life. Everything else is just background noise, you
That's right.
know? So,
So the baby will benefit from the truth,
absolutely.
and we feel pretty comfortable that she's living the truth and not just joking.
Yeah,
And it seems like she's committed to really maintaining that truth, which is a good thing. I also would you say it also comments on her resilience because, there's a lot of stuff with this boyfriend, her sister, and even some of the pressure from the medical staff now and her doctor before. S Other people might have given up, but, uh, seems like she's done really well.
yeah, she fought tooth
So,
and nail through the whole thing, and
yeah,
everything was working against her.
yeah,
Absolutely everything. And
mm,
she did not back down one bit. She did not slip up. She went all in for this child, and I think that's a beautiful thing. You know, that's a mother's, you know, uh just blessing. Absolutely. That's like a
mm,
lioness right there.
that's right. Well, I wanna thank you. This has been an outstanding discussion, I feel, and I even though the end's a little bit of a cliffhanger, wouldn't you think it still leaves a positive note, and I think for people who are actually in recovery now, it's a good example. You will potentially have to deal with the stigma, but if you maintain that commitment to moving forward and trying to do the best that you can despite what happens, you can still get blessed with amazing outcomes, and that's what's happening here. At the end of the day, I guess it doesn't really matter what anyone else thinks because she keeps going forward and she's true to herself. And I think I'll leave it with this: the fact that she did not disclose the whole interaction with her sister to her physician, um, is that necessarily a bad thing? Because in the end, she did send her sister away.
Yeah.
Uh,
I think she just trusted her own instincts and handled it the right
yeah,
way,
yeah,
and just, she handled it, which is very impressive.
yeah,
And that shows even more her, trustworthiness as a mother to protect her child and do what's right
right,
for it. And,
right,
like you said, this is a very positive, inspiring story for a mother, in this situation. She
yeah,
did what she had to for the child, and, you know, she, that's a very beautiful thing. I praised the whole situation.
yeah. Well, Mr. Disman, we're going to give you the last word here because we know that you're an advocate for the changes that can occur when people commit themselves to their recovery. So, for somebody who's listening, who might be in the position of this mother today and what happened, the circumstances, what advice would you give them?
I'd say stick to your guns and trust your mother instincts. Always trust your instincts as a mother, and don't worry about the background noise. Don't worry about how they see you. And I'm sure you don't. You just worry about your child and doing what's right for it. We're given these natural instincts and natural urges as parents to do what's right for our child, and you trust that. And you know, I see your good work. I stand for your good work, and you keep doing it. It's a beautiful thing.
Right. Yeah, very well said, Mr. Dipman. And I think, especially as our nation continues with, the fallout from the opioid epidemic and things like that, and people struggle. It's good. I think your words give hope to people who might be in that situation and might not really have anyone else to believe in except their own commitment to their cause and working hard. So thank you.
Yeah, anytime. Thank you for involving
Yeah,
me.
yeah. I want to thank our audience for listening today, and once again, we invite you to the next episode of Let's Talk About Addiction New Beginnings and Recovery with Mr. James Dittman and myself, Dr. Alfonso Brown. We will be here next week with a new release and hopefully some thoughtful discussion. Once again, I want to thank you all for your time. Peace, love, and continue to work hard. Right. Take care.